I'm not in a monogamous relationship, and I just want to make sure that I'm protecting myself.
I don't have a boyfriend, but I do sometimes see someone I like.
I like boys and girls, but I'm not sexually active.
Because I'm sexually active, I get myself tested every 3 months.
I think your doctor is a good person to talk to about sexual health because they can help you as far as doing an assessment of your risk. Your doctor can be a partner in your journey during your teenage years. It's the physician's responsibility to make sure that we take a complete and comprehensive sexual history on all patients. But for teenagers, I do it with every visit. I say, is everything okay? Do we have any needs in regards to sexual health?
Sexual health is about having a positive and respectful and responsible approach to sexuality and relationships. You can't tell if your partner has an STD just by looking at them. Most STDs don't have any symptoms, so a good way to have a safe and healthy sexual relationship is to go with your partner and get tested before you have sex.
A sexually transmitted disease can be passed on from one person to the next through any type of sexual contact, typically penile, vaginal sexual contact, or it may be even passed on through skin-to-skin contact.
I know sometimes people feel that oral sex is much safer, but you still can contract STDs that way as well.
STDs from oral sex?
Yes.
The person at risk for getting a sexually transmissible infection is anybody who has unprotected sex. We try to, first of all, encourage young people not to have sex.
But for those who choose to have sex, ways to prevent STDs are going to be to use condoms. Amongst teenagers, that's a very common method. But not only using a condom, but knowing how to use the condom.
I had a sexual experience with my first partner, and I was like, I need to tell the doctor, and I know they're gonna ask if it was with a female or male, and I need to be honest. It was scary. My doctor was very cool. She calmed me down. She was like, it's okay. I see that kind of thing all the time.
So when was the last time you had sex?
It was about a month ago.
Okay. Did you have sex with males, females, or both?
Males.
Okay. And it's important at the onset of the relationship with the patient to tell them that I know that things may be embarrassing. I'm going to meet you where you are, as you are, and appreciate that.
When I went to a general checkup for my doctor, it was the first time I asked about sex. So I was nervous about asking, and the reason I asked was because I was very curious. She asked if I was sexually active, if I was dating a boy or a girl, and I said I am not currently sexually active. I like boys and girls, but I do not have a boyfriend or girlfriend.
I teach physicians all the time about being as non-judgmental as possible, especially when you're talking about sex.
When I spoke to my doctor, I had a negative experience. I had a new partner and we used protection, but I developed like a rash and I just felt like I should go get it checked out. And she looked at it and she said, if it looks like a duck and it quacks like a duck, then it's probably a duck. And I just felt like that was really inappropriate. Like I left the appointment crying because I was so upset. And finally they called me back to get my actual results and they were negative.
If your doctor is judgmental when you bring it up, then you really need to think about if that is the provider for you. When I go into the room, I say everything that we're going to talk about in this room once the parent or guardian steps out is confidential, unless I think that you're going to harm yourself or others. I encourage all physicians to have policies that are posted in their office to talk about what are the confidentiality issues.
Confidentiality is really important because I know that if I were to be having sex and my mom was informed, I would be like, I'm never going to talk to you ever again. So there has to be trust.
If anyone finds it hard to talk about sexual health with their parents, then they should definitely talk to a doctor.
Now when I talk to my doctor about sexual health, I really don't have a problem with it because I developed a good relationship with my doctor.
Learning about sexual health and the issues around it make it easier to talk to a partner or partners. The more you talk about it, the more comfortable you get talking about sex. So you can say, no, that's gonna put us at risk for HIV, herpes, gonorrhea, chlamydia, syphilis. So let's not do that, let's do this instead.
As a young person, you have the right to talk to your healthcare provider about your sexual health. You don't have to be embarrassed. Your provider can help you figure out for which STDs you need to be tested and also help you figure out how to protect yourself against getting STDs.
You need to talk to a person who is experienced in health. It's like, duh.